Now, the Department of Health has handed over a backlog of over 35,000 toxicology cases to clear the National Health Laboratory Services. Health Minister Dr. Chairperson said about 2,500 of the pending toxicology tests are older than a decade. These reports are delaying police investigations and mortuary autopsy reports. The National Health Laboratory Services says it would provide more resources to help reduce the backlog. The forensic laboratories received a 138 million rand conditional grant from the Treasury for the 2022-23 financial year, which the National Health Laboratory Services says is not enough. It said more than 70% of the cases received for toxicology tests lacked background information, and load shedding had severe impact on productivity as samples could not be run during power cuts. The target turnaround time for new cases was 90 days. Professor Eric Buch, he's the chairperson of the National Health Laboratory Services Board, and he joins us now live from Pretoria. Prof, thank you very much for your time here on ENCA. Just give us a clear picture, because numbers fly around, and I just want to hear from the National Health Laboratory Services Board itself what the backlog looks like at the moment.
So you're quite right. The backlog is in the order of 35,000 cases. It goes a bit up and down each day depending on the what tests have been done on the day. And the tests are of three kinds. The first one is alcohol blood testing. The second is food chemistry analysis. And the third is toxicology itself, in other words, poisons in effect. So those are the three categories, and the 35,000 encompasses all those three. And yes, that's the backlog we had when we took over the lab services. And yeah, we've got quite a turnaround plan that's on the move.
What does the plan look like? Because my understanding is that, especially with the toxicology report, doesn't it necessarily take very long, Prof, because there's many poisons that could have killed the person, and you know, scientists have to test each and every one of those poisons. Am I understanding it correctly?
No, you're spot on. You know, it's not as if you get asked to test for one specific poison, for example, unless there's a particular concern that's associated with it. But I think the important thing is that you started by saying that there were no generators and tests couldn't be done when there was load shedding, and we're in the process of sorting that out. So the labs, when we took them over, the facilities are too small. So even if we got more machines, we haven't got place to put them in. There were a lot of managerial posts that were vacant. There was no adequate procurement system to get supplies that you need for testing. Some of the equipment was outdated, and we needed to invest in equipment. Many of the labs didn't have generators, so the moment the power went, everyone had to stop working. You know, there were a variety of systems. A system for recording the information. The information system was not up to date. So there were a whole range. I can continue on. And in a sense, we put in a turnaround plan, which includes new facilities, more staff, more skilled staff, and started to put in targets towards clearing the backlog. We have 4 venues. We have labs in Johannesburg, Pretoria, Cape Town, and Durban. We've cleared the alcohol blood testing backlog in Cape Town and Durban. We're beginning to chase that in Johannesburg and Pretoria as well. We've also cleared the food. We're clearing the food chemistry, checking the food for poisons. We're beginning to clear that backlog as well. So that's, there's a lot of work to be done. We've also employed in the NHLS a new executive for strategic projects, a chief strategic officer, and the first task we put her on, and she's a public health medicine specialist with extensive management experience, and is to sort of work on turning around the the forensic chemistry laboratories. As a board, we've also indicated very clearly that we will not simply rely on the conditional grant, because if we capped our expenditure in the labs on the conditional grant, we would be looking at a very, very slow process. So we're ready to invest additional resources and equipment and staff, in reagents, and in the, also the procurement systems to really move things along. And so the board at our meeting a week or two ago made a decision and said, look, this has to be turned around. It's in the national interest. We're a public entity that serves the national interest. And we've asked the CEO and her team to give us a clear plan and tell us what it's going to cost to sort this out. We run a very effective National Health Laboratory service across the country. We have well over 200 laboratories. We have great expertise in the organization. We run good turnaround times, low costs, and committed staff, and that's what we're bringing to turning around the forensic chemistry laboratories as well.
And you talk about the, the fact that the backlog, obviously, this was handed over to you already by government, the way that it looked back then, when it was still, even higher than the 35,000 that we speak about today. So in between the time that the services were handed over to NHLS and now, what has been the delay in fast-tracking this, besides the toxicology example that I gave you? Are you receiving no support, for instance, from the government as a public partner?
No. So first of all, the Minister of Health is a strong supporter of the NHLS and the work we do. So there's no shortage of support there. Our CEO has been meeting regularly with SAPS, looking at joint strategies as to how we can take it forward. But I think the delay really is that once you get handed over the service, you can't instantly have new equipment, new machines. You can't instantly have new staff. We're a public entity. We're subject to the Public Finance Management Act and all the prescripts of labor legislation. We have to duly advertise posts. We have to interview. We have to put out tenders for procurement. If you've got to find, like in Pretoria, we're in almost, I wouldn't call it a cubbyhole, but it's not much bigger than that from the perspective of a laboratory, what you need. We've got to find new facilities for our laboratories in Pretoria. And then again, you've got to put out a public tender to secure the space. And we work very hard in the NHLS to clear out any corruption and to run a clean organization, to ensure unqualified audits. And, these things take time. If you're going to procure, for example, more reagents, and then you've got to put out a tender for those reagents, and you've got to adjudicate the tender and procure properly. So we're moving as fast as we can, and I think our aim is to clear out the backlog in food analysis, food toxicology analysis, and the blood alcohol tests and analyses by the end of the year. That's the target we've set ourselves. The toxicology we're still analyzing because there are a number of complexities with it. So for example, some of the cases are more than 5 and even more than 10 years old. Now, it may be that for whatever reason, the police sent the toxicology test 6, 7, 8 years ago, but the case is no longer active. And therefore, we would be wasting our time and resources testing for toxins when it's no longer required by the police. So we're collaborating with SAPS to look at each of these cases and say, well, do you or don't you still need it? And in other cases, we lack a whole lot of information. So our new systems will ensure that when we get a specimen, that we have all the information, and if we don't, we immediately follow it up. But if you've got a request form that's missing a whole set of information that may be essential to any case, there's no point testing it because it goes nowhere. So we don't want to waste precious time and resources doing tests that are not of value. So we're working with SAPS to try and trim that down. So it's a bit early for us to give an estimate on clearing the toxicology backlog.
And I'm just
as opposed to, so just again to emphasize, in your byline, you've got 35,000 toxicology. They are all, in a sense, toxicology, but it's really forensic chemistry, of which toxicology is one section.
Yeah. And so Prof, it means that those
toxicology backlog.
So it means that if there are still those families, I understand that you're saying you're waiting to have a proper meeting with SAPS management to find out which cases exactly are still being investigated. But it essentially means that there are people who 10 years ago, a family member died and they expected to find closure and they still haven't to date.
Well, it's more than that, I mean, and we're very concerned about it. The meetings with SAPS have already happened. They've started. It's a process that's in motion. But you can imagine, sometimes people can't get a final death certificate. They can't, there may be that they have life insurance that they can't access because of this. So I mean, the implications for families are really kind of not just traumatic, but may have material implications for them as well. And that's why we're committed. That's why That's why we've committed as a board to in a sense, dip into our reserves and our cash reserves, and to invest in what's required to clear this. That was the task given to us. That's the task we're going to deliver on.
All right, Prof. Well, I'll try and remember to get a hold of you towards the end of the year and find out if you've been able to meet your own target. Thank you for speaking to us, Professor Eric Buch. He's the chairperson of the National Health Laboratory Services Board.